This is Todd Ponsky reviewing another article for the Journal of Pediatric Surgery. Today we're going to review non-operative treatment of acute appendicitis in children, a feasibility study. The first author is Dr. Joseph Hartwich and the senior author is Dr. Thomas Tracy. So what they did is a prospective trial trying to understand the safety and efficacy of antibiotics alone for the treatment of appendicitis. So they approached patients between the ages of 5 and 18 years of age who had less than 48 hours of symptoms. And if they agreed to be part of the study, they were put on the non-operative arm. If they did not want to be a part of the study, they were asked to be controls. So they had 24 patients that agreed to be part of the non-operative group. 50 patients ended up being controls. And in the initial period of time, 3 patients did not get better with the antibiotics. So those patients were treated with appendectomy. So then you were down to 21 patients. Of those 21, 2 patients developed symptoms later on. They had basically recurrent appendicitis. So then you're down to 19. And then 2 patients who were doing well chose to have their appendix taken out as an interval appendectomy. So now you're down to 17 patients. 17 patients ended up not needing their appendix out of the original 24. So 71% of patients went appendectomy free. So what were the results? Okay, so overall 71% of patients went appendectomy free in the non-operative group. But how does this compare to the operative group? So when we look at perforation or complications, there were none in both groups. When we look at quality of life score, the quality adjusted life month score, actually the non-operative group had a higher quality of life score than the operative group. And when we look at cost, actually cost was substantially lower for the non-operative group than it was for the operative group. We hope you enjoyed this review. I want to thank Sophia Abdulhai for help with this review. Please leave comments and questions below and tell us what studies you'd like us to review next. Thanks.